Hi, this is Dr. Kuykendall, and today I just want to show you a little bit of what it is to work with a patient with some neck pain, some back pain, and we're going to get a testing or indicator muscle before we begin and actually see if we see some strengthening in the muscle test, because at the end of the day, chiropractic has been sold and solicited as something that's helpful for neck and back pain, but the reality is it's your entire circuit breaker, right? And specifically working with this gentleman, his upper neck and lower back where he's having some issues. He's had some issue with digestion, he's had some issues with anxiety and even acid reflux and all of these types of things. If we get the circuit breaker, it's just like an electrician going into your house. If we get the circuit breaker that is in the house, that is shut off and the kitchen lights are off, we go into the circuit breaker and we turn that light back on, that electrical current, everything in the kitchen starts to function again. It's the same thing with the body, and it's a powerful thing. That's why chiropractic is so powerful and wonderful, is you're not only dealing with eliminating pain and interference, but you're actually allowing the body to begin to heal because the body has an innate intelligence. How do we know this? Well, if we have a broken arm, it begins to heal. If you've got something that's been, a surgery in the hospital with the medical community, it begins to heal. It naturally goes back to healing. So that's really cool. So the body, the power that made the body heals the body, and that's what is so fantastic about this. So let me show you some indicators. With him, he's having low back pain, he's having neck pain, he's a musician, he's played for years, 20, 30 years like this. 20, right? 30, okay, 30 years playing like this. So what I find with him is his structure in his neck, his scalene muscles are really, really tight. And you can feel right there, right? Like that hurts, like ow, right there, specifically this. So chiropractic is powerful, but also it's important to release the muscles and cause the things to become balanced again. It's not just go and get a quick adjustment by Joe Schmo chiropractor. You want to find a really good, highly trained applied kinesiologist. And you can reach out to my website if you want to learn what it is to work with myself, or you can look up ICAKUSA.com. That's the International College of Applied Kinesiology. Actually, now it's called the Professional College of Applied Kinesiology, but this is how you can learn how to take the power back in your own hands, because PCAK or ICAK, it'll take you to the same directive. You can look up in your area around the world with your zip code, and it'll tell you, go see these options. These are your options. Some cities have a lot, some have very little. So it's a powerful technique. So let's just come through. We did some work on his shoulder earlier, so I've already muscle tested this young man, and we know that the only real muscle weaknesses are actually in his pec muscles. So let me show you here. Resist my pressure equally, and he's got nothing. This is a strong guy. He has no strength. I mean, you feel it, right? So we're going to come this way, bring the arm down there, and don't let me move your arm. So again, we'll hold here. So this is his pec major muscle, and this, or pec sternal, right? Relax your arm here, where the muscles from the pec insert from here to the sternum, right? The PMS, or pec major sternal, and then there's pec major clavicular, which is the base of the clavicle. Both of them are weak, and it's actually weak bilaterally. I'll show you here, equally resisting my pressure. Don't let me move. You're really, really weak. I mean, you got nothing. This is a strong guy, but if I test his other muscle here, hold here for me, hold. He's strong. Like I could push on this thing. You could easily, you feel the difference, right? This is called autogenic inhibition, meaning if the muscle's just globally weak, he has no support. So if this is weak, all of the back muscles and neck muscles have to take over. This is the power and effectiveness of why applied kinesiology is really, really good and really more advanced than just a quick chiropractic adjustment, because we spend years learning how to do this work. But let me just do a quick adjustment with him, and then we're going to do a little work with his back, and we'll come back and actually see, just by working with a circuit breaker of a box of his body, right, the electrical system, if it's actually strengthened him or not. So let's try this on. So with an adjustment, we're going to go through here. We're going to find there's 7 cervical vertebrae, right? We're going to find which one's out of position for him. And over here, very clearly, I can feel it. I mean, there's motion here. You can feel that. You can feel motion here. But do you notice here there's not motion? It's just literally blocked, right? So we're going to go in this position. We'll do a tiny little gentle one. It's actually a very gentle thing. That sound is gas leaving the joint space. It's not a loud, like it's not aggressive. It's very, very gentle. So we'll just do a little gentle one here. Good. Right there. So we're getting the vertebrae back into position. We'll do one other gentle one here at LC5. the lower cervical spine. Here we are here. Good. And he actually has got really good motion in his neck now. So I'm going back through. You feel how this is moving equally to the other bone now. Okay. And over here, more motion. Now, I'm not one that likes to have a patient come in all the time. You don't need just adjustment after adjustment after adjustment. I really don't believe in that philosophy. I believe you want to take the biggest rocks out of your backpack, and today they may be an interference in the nervous system in a subluxation, which is a vertebrae being out of position, right? In medical terms, a subluxation is a vertebrae literally being disjointed. So there's an issue with the communication between chiropractic and medicine. That's why I think there's a big breakdown, is we're just gently putting it back into position. You can do this with all types of people. Now, some people are babies. Some people are very young. Some people are fragile or really fearful. And you don't need to use a lot of pressure. So this is an arthrostim, and it's another way of adjusting, working with the body, right? So an arthrostim applies impact. You can actually see on my hand, if I push a lot of pressure, right? We're not going to ever use that much pressure on the spine. So, but what we would do is find any movement issue in his spine. And for him, what's left is his atlas, right? You've heard of Atlas, the one that carries the globe on his shoulders, the earth on his shoulders. That's another term for C1, the one that carries the head on your shoulders. So I'm going to tap very gently. It's very gentle. Deep breath in and out. So this should never be uncomfortable or scary. If you're working with the right practitioner, this is a very gentle thing you can do. And the more you affrontate and move these areas of the body that have been stuck, like if you have a shoulder that's just, you have a sling and you're never moving it, if you actually get it out of the sling and you're not in pain, you know what I mean, and you're moving this, you're actually sending information to the contralateral brain and the ipsilateral cerebellum. You're basically reaffrontating. It's like if you walked around with blinders on your eyes all day, you would eventually go blind because there's no photonic light, right? And this is how people that are blind actually end up having more sensitive ears, is your body will shunt different parts of the area to work with the deficiencies. So we don't want to have that going on. And that's why chiropractic, even just a little bit, even if you're not in pain, it's not about pain. It's about really making the very best version you can be. And here, we're going to work with this first rib. We're just putting it back into position. No pain here, right? Deep breath in. These are your respiratory muscles, the scalenes attached to the rib. And so putting that back into position can be extremely helpful, right? And what we're going to do here is I'm actually curious if just doing this alone actually helped him get better function in his arm. So let's see here. So elbow roll straight, bend keep the arm, relax your arm, bring it over just like we did before. So we're always accurate. Resist my pressure again, hold. And you're actually stronger. You feel the difference. You do feel that. I want you to be like, that's actually really good. Now, sometimes I'd have to use all my special applied kinesiology skills and find the neurolymphatic points, the neurovascular, find if a nutritional balance, but the electrical system of the neck, and because he's relax your arm, because he's a musician, and he's always doing however he's doing, will cause an interference and weakness. So I want you to get that that's a big thing, because your nerves from your neck aren't only innervating or connecting to your muscles and your nerves and in your arms, but they connect to your stomach. They connect to your digestive system. They control everything. Specifically, the neck is related to parasympathetic, so your ability to feel calm and rested and connected to life. Let's check the other, right? We did before. Bring it down, relax your arm, right there. So we're going to check now his major sternal, hold. Also strong. Let's check this side. Turn over here, good, elbow straight, don't let me move, hold, hold, hold. Also strong, you feel the difference? This is really cool, you know? And then holding here, don't turn inward, don't let me move, hold, hold, hold. And this is this is a game changer, and this is, relax that, how powerful and how quick it can be. So let me do a little work with just showing you now your low back. Now, keep in mind, this is very basic for the purpose of this video. It's just showing you the power of an adjustment. But I want to show you, with him, he's had a lot of digestive complaints. We did another video where we talked about that. But you actually feel a little bit of what? You're feeling actual, just quickly here. Pressure. And you said you felt it in your digestive tract.
Yeah, like right here.
You're feeling it right there. And so one of the things that can do that can be, it's right here near his liver. Right below his liver is his gallbladder. Another thing it could be is the diaphragm, right? And another thing it could be is a rib or a vertebrae out of position in the back. So myself being trained with doing applied kinesiology and chiropractic work, I just want to quickly adjust that area very gently, show you what that looks like. Because if we get motion back in that area, typically he's going to be out of a lot less pain, which is cool. And then he won't have this referral pain. Now, we don't know what's causing it right now. And your medical doctor would say, okay, well, let's run some blood work. And they would look at liver and gallbladder, right? AST, ALT, and GGT in your gallbladder, in your blood work. They may do an upper or lower GI, and they have you drink all this terrible stuff. If you don't have insurance, this is a very expensive path. So one of the most effective, gentle paths and safe paths is to try something like this first. If you don't have extreme pain or fear about this thing, doing something very gentle that allows your body to heal first. My goal is to keep as much money and all of that in your pocket as possible. And then if we need to do expensive, crazy tests, let's go for it. You know what I mean? Kind of fun. So let's go face down. I'm going to move over here to the center. Okay. Good, good. All right, so, and you can turn your head to the right. I know it's not the most comfortable positioning. So we're going to come along, and I'm actually going to test where we feel that issue is. And is it right here that was the most, or is it lower?
Right now, actually, today my
low back
is really, really out.
But the area that I was on earlier today.
But that's the chronic problem. Is
okay.
Right here. That's where all of the stress from playing music.
Got it. So he's saying that all the stress from playing his music over time is here. And what he's feeling on the opposite side of his abdomen, right at the same level, okay, just a coincidence, what he's feeling is that on the same side here is he's feeling like almost like a pressure or a hernia or a space-occupying kind of lesion, something in there. And that can be either nothing or it can be a lot of things. And so we want to do this very gentle thing, which he very, very clearly has a rib out of position. So what I want to do is I want to actually have you turn on your side, and I want you to face me, right? So come on your side here. I want you to come all the way up to the edge. We're going to do a very gentle adjustment here, but all the way to the edge. All the way, all the way, all the way. Perfect. Straighten your bottom leg. Thank you. Bend your top. Good. Let your body relax. And so I've worked with 40,000 patient visits now in the last 10 years. I've never lost a soldier, so I won't lose you either, so you can just let your body relax. We're going to give him a little bit of support here. So put this under your head for me, kind sir. Beautiful. All right, and then you just let your body relax. We're going to get you in position. Put this hand on this elbow, just like such. Right? This one holds tight, this one relaxes. So it can be very gentle. And the purpose of this, I'm just showing you how gentle, even on a bigger guy than me, we can very easily get it in a position like that. Boom. And you felt it move right back into position. Very nice. So go face down for me. And it's just a very gentle pull maneuver where we can get this area, because you have 12 ribs. These are meant to be here to protect you from a sword or a stab or any kind of damage. Otherwise, your vital organs are exposed. So using that tiny little maneuver, chiropractic should be very, very specific. You want to work with somebody that's not just giving you these large, crazy adjustment moves. It's not about that. Specificity is key. So we come in here, we get the little Arthur stem. Again, just actually moving a little bit more of this vertebrae because he's really stiff in here. We're just helping this spine move properly. And that feels comfortable, right? No main pain, he actually feels good. Most patients will feel more calm and relaxed after doing an adjustment like this, all right? Same thing here. We're going to adjust just to show you there's other ways, because everybody's seen the adjustment where we go like this, and that's very good, right? That's powerful, and that moved really nicely. This rib really out of position. But we can also just very gently, for squeamish people, come in here and move just like this. Now, your structure in your shell, right? If the shell on a crustacean living at the bottom of the ocean is not in position properly, it's not protected, But in the nervous system, all the electrical wires and everything's going here, all your intercostal nerves, it causes pain, it causes interference, it causes muscle imbalance, which makes you tired. But these nerves will innervate your heart and lungs and all these things, so it can give people all types of weird neurological symptoms where they're kind of, one, anxious, or two, just really like, I don't know what's wrong with me. A lot of this pain here in Trevor's abdomen could actually be coming from his spine because he's got enough of years playing music where he'll have some trouble. So what I'm going to do here now, using the ArthroStim, is fast stretch the muscle. So I'm actually using it to stretch the muscle spindle cells, and as it attaches to the bone, the Golgi tendon organs. And what this allows us to do is allow this muscle to relax. Now, a massage therapist or a really good applied kinesiologist like myself, we could do all of that, but that's not the purpose of this video. What I want to do is just get these muscles to balance and calm down really fast. And I'm already feeling, just by pushing the muscle spindle cells together, you can get the muscle to neurologically relax. So actually, I feel more motion in his spine than when we began. You can feel that, right?
Oh, yeah.
So this is good. Lumbar, low back. What is this going on with him here? And so with him, where did you say the pain was?
Right where your hand is.
Right here, okay. So this is L5-S1. It's right where the lumbar and the sacrum. This is a billion-dollar industry, and this billion-dollar industry causes people to miss work. It causes all of these big corporations to spend billions of dollars on trying to set up ergonomic desks because we're sitting too much these days. But at the end of the day, motion is life. So if he's not moving, we don't have motion. If we don't have motion, we're not having afferentation, meaning sensory input. So colon, digestive, all the things, sexual organs, all the things, strengthen their legs, strengthen your abdomen and your core is totally going to be affected here. For women out there that have babies or that have had many babies or are trying to get pregnant, having your electrical system of your body is to be looked at is huge, so huge. You got to do it. There's no drug or surgery that's going to provide this for you. To me, it's very, very basic common sense to me that if the electrical outlet is not working in a room of the house, you need to turn it on. Working with the nervous system of the spine, this is how you turn it back on. And so it's very, very important to have this done. So I hope that actually makes an impact on you out there. So with this gentleman, because he's got a lot of tightness here, we're actually going to just move that vertebrae because we don't need to put him in an uncomfortable side position like we did a moment ago, although that felt good, right? Mm-hmm. Yeah. So we'll use this, and I can feel, this is L5, I can feel where it's really stiff. I can feel it starting to move. It's very simple to do so. And then over here, he's really locked up right here, L3 on the left. So we come in, just gently adjust the spine. Now, how will this go back into position? Well, sitting in the same poor position, crossing your legs, it's the same repetitive position you do every day that causes a lot of this. This is T12L1. We're going to get this vertebrae moving. And it's a very gentle thing. And when your body starts to get into a more proper alignment, everything can start to relax. Your muscles don't have to overwork. Because muscles aren't overworking, your nervous system isn't overworking, and you'll feel more calm. These are blocks. I just put them in here. I've been doing this so long, I forget that people are like, what is that? It's kind of like putting your car up on the rack, right? His pelvis is actually rotated this way, right? His iliac crest. So we put the block down here at his trochanter in this iliac, which allows his pelvis to shift back this way. It's a very gentle process to do this. And then we use a percussor. Massage does this, percussion does this. And this allows us to go in there and literally work, because where he's feeling this pain is L5, S1, right, which is the last vertebrae in the sacral base, and the sacrum and ilium, or iliosacral joint. So we're just going to gently move it while he's on the blocks. This is called blocking. It's very, very effective to do so. And we can literally open up his spine. And the thing he'll tell me later is, man, that was so good. That feels much better. I don't have any doubt in my mind, gosh, I hope this helps Trevor or the other thousands of people. It's just plain simple science. And I think we're finally getting to the point where we're kind of realizing that, you know, doctor actually means, from the word docere in Latin, is to teach. And if your doctor isn't teaching or actually putting their hands on you, I would look for a different and better doctor that you like more. Doctors are supposed to be there to help you. And the truth is, I saw thousands and thousands of people in practice. I still work with people online and also at the retreat center in Costa Rica. However, doctors getting tired too, just like you do with your work. And what it's become more about is insurance. It's become more about money. And it's a sad thing, but it's what's happened, right? And so be aware of, if you don't feel like you're getting the best care, that there's a lot of doctors out there. And a lot of the doctors that practice what I do, they don't necessarily take insurance because they're sick and tired of it. Because the insurance game, paying $5 to your Medicare or $30 to your insurance company, they're not there to fix you. It's a business. And so what this is about is actually allowing your body to heal. And you pay a little bit out of pocket, you're going to get your life back, folks. And I mean, you really get to choose. But I personally tried the medical route for many years when I was so sick with fibromyalgia, chronic fatigue, severe anxiety, struggling. But the reality is, if you'll just go and just pay a little out of pocket, see the right guy, you'll get fixed, or right woman, and then you're going to be up and running. So let's actually come back. So I'm just going to test. And he's moving really well. Like, this is probably the best your spine's moved. There's a little bit restriction up here. We haven't messed with this yet. Let me test one last thing on you, my man. A lot of this low back pain people struggle with. Let's do this. Let me have this leg. Hold that leg for me. Don't let me move your body. Hold. That's your medial hamstring. Relax your leg. Point the toe out. Hold there. Testing lateral hamstring. Raise this leg off the table. Don't let me move it. Hold. Good. Let's check piriformis. Don't let me move it. Hold. So these are not things you're going to see at typical chiropractic testing, but what you're going to see is typically an adjustment that'll last, a few minutes and you're gone. What I like to do, and most of your really good docs, is they spend time with you, and that is the importance, because we need time, right? That's why I love my work, is because we get to spend more time. But I want to check one last thing on this gentleman. Let this leg relax, and we're just checking to see what his range of motion is here. So far, that looks good. Over here, see here. And here he actually has less motion. So here he comes about this far. Over here, he's coming out about, I don't know, what'd you say, 30, 40 degrees or more. This one is about, 15, and it just kind of blocks. So what these are typically your piriformis muscles or what are called your gemellus muscles, but they insert, I'll show you here, both sides of the pelvis, from your sacrum into the insertion of the greater trochanter. And a lot of times people get this chronic low back pain or chronic tightness. It's due to this muscle. So we're just going to show you really quickly. I'm using a little bit of active release technique. So I'm just going to go in there with my elbow right on the muscle. Breathe and let your body relax. Good. And we can literally, actually worked on a physical therapist a few nights ago, and she said, I feel terrible about saying things about chiropractic over the years because I've struggled with this hip pain for 25 years. I am a physical therapist. I've seen all these different folks, and you fixed it in one treatment. And I don't need the accolades. It's not about that. The point is that physical therapy is powerful and awesome, but we weren't getting to the exact thing that was the issue. And for her, it was a muscle entrapment. So they were trying to strengthen and condition and rehabilitate, but they hadn't just simply put their thinking cap on and gone right into this. Like right there, you can feel this muscles in spasm. So I'm just holding there. So we're going to come back. Before he had about 15 degrees, right? Now he's able to come out about a good 40 degrees. It's about equally each side. So with motion back in the spine, balance back in the muscles, his pelvis will stop rotating out of position. Taking it one step further, being aware that the muscles of the whole body, like your pectoralis muscles, have so much to do with the organ, the liver. And the liver has so much to do with the emotion, resentment, and frustration, and even gallbladder, like being frustrated and resentful and galled and really kind of like upset with somebody. We actually asked him earlier, and he said, he's got some stuff going on in life that relate back to frustration, right? The point is that it's all interconnected. There's not a bone or a muscle or a nerve that's not innervated or connected to something dealing with the emotional body or the energetic body or the quantum body. And all these bodies we know so little about. We think we know so much as humans, but we're really learning that we know so little. So allowing yourself to be more open, more teachable, if you're really struggling with something, and experiment with some different really amazing practitioners, I think you'll be amazed. And the truth's out there. That's why we do the videos we do here. So we want to show you that there's possibility. You don't have to take everything I take as 100%, but I want you to look in for yourself, because so much of this is science-based and even beyond science, where so many things that we are learning is that an emotion can affect an organ or a muscle, or it's really the most amazing thing. This is not woo-woo anymore. Like, we're realizing as humans on this tiny little speck of Earth that we're interconnected with everything. We're floating in an infinite galaxy and universe. So just being aware of that always puts things back. And so I always love to be teachable. Being teachable was what allowed me to actually get well and to heal when I had been to every medical doctor under the sun and actually was very against, much like Bruce Lipton, against trying to do this. I didn't want somebody waving crystals and wearing indigo and waving sage. But turns out there's actually great time to do those things. But it's our own belief systems that if you open up that there's more possible out there, then you're going to see a better improvement in your life. And so I just say open up to possibility. We're learning that we don't know anything as humans right now. So this was great. Thank you for participating today.